Hi, I'm Dr. Verma. Today I'm going to talk about a unique case of bilateral total hip joint replacement which has been done in a only 22-year-old girl. Usually we do total hip joint replacement in little elderly people where there is arthritis or AVN of the head of the femur, which was commonly seen after corona times because of excessive use of steroids and other problems. But this child, only 22 years, came to us with severe bilateral hip pains. When we investigated her, she was found to have a sickle cell anemia.
Assalamu alaikum. Hello everyone. My name is Aisha Mahmoud Khaleel from Kano, Nigeria. I came here to India to SHALBY Sanar International Hospital to consult a doctor for bilateral hip problem.
I am proud to say that in SHALBY Sanar Hospital, we have a great team of hematologists, experienced anesthesia doctors, ICU specialists, and my team itself is a very big team. This surgery was done in association with our orthopedic oncosurgeon, Dr. Lokesh, who has a good experience of complex hip joint replacements. So we both did this surgery one by one, and I'm really happy to announce this was a great success.
So they did the first hip replacement, which she selected the right-hand side, and they did it. It was successful, being highly successful. So they decided even to do the second hip after 3-4 days, which is also successful. Before she was limping, and now she can walk like any normal person.
And thanks to my doctor, Dr. Rajesh, Dr. Lokesh.
Minimum 30 years, but up to 40 years, she can enjoy her life. And in future, if it is required, we can do a revision hip replacement once again. So I wish her all the luck and thank you so very much for listening to me. Thank you.